morning, everyone. It is a great honor for me to join this first workshop on developing national framework for disease donor organ transplantation in Nepal. First, I would like to express my sincere thanks to Professor Divya Singh and Professor Amir Badus Reza, Chairperson of the Human Organ Transplantation Coordination Committee of Nepal, for inviting me, and to all of you here today for your commitment to advancing disease organ transplantation in Nepal. Today, I will talk about developing a national system for effective disease organ donation and transplantation. I have nothing to disclose, and I will divide my presentation into 3 parts listed here. I will mainly focus on the practical components needed to build an effective national system. Before we begin, let me start with the main question of today's talk. Why do some countries succeed in disease organ donation while others fail? For my experience, the answer is quite simple. The success of disease organ transplantation depends on how the national system is organized. The foundation for designing a disease organ transplantation program is the Madrid Resolution. The Madrid Resolution was adopted in 2010 during the 3rd Global Consultation on Organ Transplantation to promote national self-sufficiency. The resolution highlights 3 main roles for governments: increasing organ availability, ensuring fairness, justice, and transparency, and preventing the need for transplantation through disease prevention. National accountability can be understood in 3 areas. First, capacity control. Second, regulatory control. Third, the ethical context. First, capacity control, including healthcare infrastructure, workforce, and financing. Second, regulatory control, including legislation, regulation, and systems for monitoring and evaluation. Third, the ethical context, where government leads a shift toward recognizing organ donation as a shared social responsibility consistent with the WHO principles. To support these goals, a national framework for organ donation and transplantation was proposed. In Korea, 2 additional components were emphasized: public awareness and education, coordination, and policy agencies. So the question is, what must the government do to start such a program? Government have 2 key missions. First, to establish a legislative and regulatory framework, which Professor Jeremy Chapman will discuss in detail. Second, to establish a national agency or National Transplant Organization, NTO. Then, what is the role of NTO, National Transplantation Organization? In most countries, the NTO performs the major regulatory functions in disease organ donation and transplantation. The Spanish ONT model clearly demonstrates that strong government support in operating NTO is crucial for successful donation programs. The regulatory function of NTO include oversight of standards and performance, providing criteria and guidelines, certification and authorization of transplant-related processes and organizations. These functions should cover oversight of hospitals, organ procurement organizations, organ allocation and waiting list, and national registries. And the transparency and the trust in the system largely depend on the strength of the NTO. Among these functions, the most sensitive area is the management of the waiting list and organ allocation system. In many countries, this coordinating role is managed by the NTO. The three principles are essential: traceability, equal accessibility, compliance with allocation rules based on utility, justice, and respect for persons. And Professor Peter Stark will explain this in more detail in the next lecture. Third important role of the NTO is coordinating transplantation activities and developing national policies. For example, in Australia, the NTO reviewed the entire transplantation system and developed a roadmap to improve disease organ donation. Health inequality is also an important issue. In India, programs such as Yojana and Vaitsalya Yojana support transplantation access for low-income populations. Another very important policy-related issue is related to the financial burden related to disease organ donation. In 2016, the Declaration of Istanbul Custodian Group discussed the issue of payment to families of deceased organ donors. In some countries, funeral costs or hospital expenses are supported for donor families because officials believe such support encourages donation. However, the DICG has emphasized that direct financial payment to donor families fall out of ethical transplantation practice. This raises a practical question. What happens if the government cannot have sufficient financial resources? In Korea, the system evolved over 10 years from recipient payment to hospital coverage and now to the national health insurance system. Our experience also suggests that financial incentive alone do not necessarily increase donation rate. Various non-financial incentives are also being discussed, and ultimately these decisions depend on each country's financial capacity and policy direction, and this is also a key role of the NTO. To ensure transparency and evidence-based policy, many countries have established national transplantation databases. In some countries, the NTO directly manages data. In others, this function is outsourced to institutions designated by the government, often to strengthen research capacity. The database usually includes 4 categories: living donors, deceased donors, transplant candidates, transplant recipients. Linking these data with the waiting list and the organ allocation system improves operational efficacy, while integration with national health insurance data can reduce errors. International collaboration is also increasingly important as donors and recipients often move across borders. Therefore, linking national data with global databases such as GeoDT or ASTRAC can strengthen international collaboration. The ASTRAC system has developed by the Asian Society of Transplantation with the Curie Foundation platform. The ASTRAC-H platform includes 227 variables across 5 domains for kidney transplantation and provide secure web-based data entry, real-time visualization, and automated data verification. In Korea, KONOS, the NTO, is responsible for managing the waiting list, allocating deceased donor organs, coordinating policies, and regulating and evaluating transplantation activities. As you see, it is essential to prioritize the development or strengthening of an NTO that is optimized for your country's own situation. Does the NTO have to be operated by the government? There is no single mandatory model. Countries adopt structures based on their context. Structures may vary, but legitimacy, accountability, and operational capacity is essential. Once this NTO is established, 2 operational components remain: the Organ Procurement Organization OPO and public awareness. The first role of OPO is to establish standardized guidelines for the organ donation and procurement process. For this purpose, critical pathways should be developed for each step. The second major role of the OPO is to maximize deceased organ donation. This requires developing and maintaining qualified organ procurement coordinators and providing continuous education and training for OPO professionals. In the past, many hospitals in Korea operated hospital-based organ procurement programs called HOPOs. However, in Korea, this model had several limitations. Non-HOPO hospitals showed limited participation. The utilization of deceased organs was somewhat low, and the policies differed between hospitals. Therefore, we developed a National Independent OPO System, IOPO. Compared with HOPO, IOPO can activate procurement in most hospitals, maximize utilization of donated organs, apply standardized procedures, and coordinate with tissue and eye donation. Professor Ik-jin Yoon will explain the role of Korean Independent OPO CODA in more detail tomorrow. Finally, the last operational requirement is how to increase public awareness of organ donation. In some countries like Spain, this is government-driven. In others, such as the United States and Korea, NGOs play an important role. Regardless of the structure adopted, the priorities for public awareness follow this order: healthcare professionals, donor families, students, and community leaders. In Korea, the Korean Society for Transplantation established an NGO called VitalLink, which has conducted public awareness activities for the past 10 years. These activities include community programs during the National Life Sharing Week and educating students. In the past, we even climbed the ice peak with transplant recipients to promote organ donation. Perhaps one day in Nepal, we could organize a Himalayan climbing project together with the World Transplantation Game. Developing effective strategies and the implementation model is essential, and Professor Young-Hoon Kim will discuss this topic in more detail tomorrow. In this way, Korea's deceased organ transplantation program developed followed the structure of the Madrid Resolution, following a government-led model. Through legislative initiative, NTO OPO and public awareness programs, Korea has increased deceased donors and reduced overseas transplants. However, Korea's deceased organ donation rate still remains in the lower to middle range globally, and only about 3.4% of adults had registered donor card as of 2023. Another important point is that organ transplantation activities in Asia are still in the early stage of development. For this reason, since 2011, we started the VitalLink International Project, working collaboratively with several Asian countries to enhance capacities in disease organ transplantation programs, striving for regional self-sufficiency. In 2023, we started the VitalLink Academy program. This initiative has expanded under VitalLink International, enabling colleagues from many Asian countries to visit Korea and share experiences. In 2024, we organized the TTS 2024 VitalLink workshop in Istanbul. I would like to invite you to join VitalLink International so that we can work together until all Asian countries achieve self-sufficiency in organ transplantation. Nepal and many Asian countries face barriers such as lack of awareness about organ donation, limited understanding of brain death, cultural considerations, and the lack of coordinators, etc. From an external perspective, Nepal appears to have the essential capacity for disease organ donation, but the system remains fragmented. The key question is this really true? This is both a challenge and an opportunity. However, if we work together, these barriers can be overcome. Ultimately, success does not depend on individual relationships. It depends on building a functioning system. Nepal has achieved extraordinary accomplishments despite many challenges, and I believe you will overcome this as well. Thank you very much for listening. Thank you.